Most important MCQ for nursing exam.
Question number 1. Blood should be stored at which temperature? Option A, at 2 degrees Celsius to 6 degrees Celsius. Option B, at 20 Celsius. Option C, at room temperature. Option D, at 20 degrees Celsius to 0 degrees Celsius. Right answer, at 2 degrees Celsius to 6 degrees Celsius. Question number 2. How much blood is drawn from a donor when 1 unit of blood is donated? Option A, 400 milliliters. Option B, 300 milliliters. Option C, 200 milliliters. Option D, 100 milliliters. Right answer, option A, 400 milliliters. Question number 3. During a blood transfusion, a client develops chills and headache. What is the priority nursing action? Option A, cover the client. Option B, stop the transfusion at once. Option C, decrease the rate of the blood infusion. Option D, notify the healthcare provider immediately. Right answer, option B, stop the transfusion at once. Question number 4. All are complications of massive blood transfusion except option A, hyperkalemia, option B, alkalosis, option C, hypercalcemia, option D, hypothermia. Right answer, option C, hypercalcemia. Question number 5. The primary reason for infusing blood at a rate of 60 milliliters per hour is to help prevent which of the following? Option A, emboli formation. Option B, fluid volume overload. Option C, red blood cell hemolysis. Option D, allergic reaction. Right answer, option B, fluid volume overload. Question number 6. What immediate nursing intervention will you take in case of blood reaction? Option A, inform the physician. Option B, stop the transfusion. Option C, inform blood bank. Option D, monitor vital signs. Right answer, option B, stop the transfusion. Question number 7. The nurse is monitoring a client receiving a blood transfusion when the client develops a cough with shortness of breath. The client also complains of a headache and a racing heart. What should the nurse do first? Option A, slow the infusion rate. Option B, replace the blood with saline. Option C, administer an antihistamine. Option D, place the client flat with the feet elevated. Right answer, option A, slow the infusion rate. Question number 8. The nurse is caring for a child receiving a blood transfusion. The child becomes flushed and is wheezing. What should the nurse do first? Option A, notify the physician. Option B, administer oxygen. Option C, switch the transfusion to normal saline solution. Option D, take the child's vital signs. Right answer, option C, switch the transfusion to normal saline solution. Question number 9. A client receiving a blood transfusion begins to have chills and headache within the first 15 minutes of the transfusion. The nurse should first, option A, administer acetaminophen. Option B, take the client's blood pressure. Option C, discontinue the transfusion. Option D, check the infusion rate of the blood. Right answer, option C, discontinue the transfusion. Question number 10. The vitamin essential for blood clotting is option A, vitamin A, option B, vitamin B, option C, vitamin C, option D, vitamin K. Right answer, option D, vitamin K. Question number 11. A child with B thalassemia is receiving therapy that includes multiple blood transfusions. This child is at risk for developing which complication? Option A, serum hepatitis. Option B, allergic response. Option C, pulmonary edema. Option D, hemolytic reaction. Right answer, option C, pulmonary edema. Question number 12. Clumping of RBCs may occur when blood of one person is mixed with serum or blood of another person. This is due to option A, antibody-antibody reaction. Option B, antigen-antibody reaction. Option C, antigen-antigen reaction. Option D, all of these. Right answer, option B, antigen-antibody reaction. Question number 13. Before blood transfusion, blood is screened for the following except option A, malaria. Option B, hepatitis B. Option C, hepatitis A. Option D, HIV virus. Right answer, option C, hepatitis A. Question number 14. Which of the following is not correctly matched? Option A, AB, universal recipient. Option B, O, universal donor. Option C, O+, most common blood group. Option D, A+, least common blood group. Right answer, option D, A+, least common blood group. Question number 15. A client has received platelet infusions. Which finding would indicate the most therapeutic effect from transfusions? Option A, HB level increase from 8.9 to 10.6. Option B, temperature reading of 99.4 degree Fahrenheit. Option C, white blood cell count of 11,000. Option D, decrease in oozing of blood from IV site. Right answer, option D, decrease in oozing of blood from IV site. Question number 16. Blood group which universal donor and universal recipient are option A, AB plus and O, option B, AB minus and O plus, option C, O minus and AB plus, option D, O plus and AB. Right answer, option C, O minus and AB plus. Question number 17. Anticoagulant present in blood is option A, enoxaparin, option B, heparin, option C, warfarin, option D, vitamin K. Right answer, option B, heparin. Question number 18. Who demonstrated RH factor? Option A, Robert Koch, option B, Robert Hooke, option C, William Harvey, option D, Karl Landsteiner. Right answer, option D, Karl Landsteiner. Question number 19. The nurse is planning to initiate a blood transfusion. Which of the following solutions should the nurse select to prime the tubing when preparing to administer the blood? Option A, lactated Ringer's solution. Option B, normal saline. Option C, 5% dextrose in half normal saline. Option D, 5% dextrose in water. Right answer, option B, normal saline. Question number 20. A hospitalized client with severe anemia is to receive a unit of blood. Which aspect of care is most appropriate for the newly licensed practical nurse? Option A, initiating the IV of normal saline. Option B, monitoring the client's vital signs. Option C, initiating the blood transfusion. Option D, notifying the physician of a reaction. Right answer, option B, monitoring the client's vital signs. Question number 21. When assessing for signs of a blood transfusion reaction in a client with dark skin, the nurse should assess for option A, hypotension, option B, diaphoresis, option C, polyuria, option D, warm skin. Right answer, option B, diaphoresis. Question number 22. Blood group from most common to less common among the Indians. Option A, B, AB and O. Option B, AB, O, B and A. Option C, O, B, A and AB. Option D, O, A, B, B and A. Right answer, option C, O, B, A and AB. Question number 23. Which of the following indication of insertion of central line except? Option A, PPN therapy. Option B, hypertonic solution. Option C, ABG sampling. Option D, CVP measurement. Right answer, option D, ABG sampling.